Welcome to this mini lecture on micronutrients. Humans need 15 different minerals for optimal health. We won't be talking further about those on the left side of this table. You should recognize most of these. Remember that chlorine we need to make hydrochloric acid, stomach acid. On the right side of the table are those that we need in trace quantities. Remember that we need iodine to make thyroid hormone, manganese and molybdenum, and selenium we need at several enzyme active sites, and fluorine is required for optimal tooth health. In this lecture, we'll be focusing only on copper, iron, and zinc. For more information about any of these other minerals, see the webpage shown. I want to start with this important take-home message that's from the Harvard School of Public Health. The difference between just enough and too much of the trace minerals is often tiny. Generally, food is a safe source of trace minerals, but if you take supplements, it's important to make sure you are not exceeding safe levels. We'll see several examples of this in the upcoming slides. Close to 1 billion people are predicted to have iron deficiency worldwide, and this is especially common in young women and children. Women are vulnerable because of monthly menstruation and because of the extra iron demands of pregnancy, and children, due to growth, are also very vulnerable to iron deficiency. And we often think about iron deficiency as causing anemia, which it certainly does, but it's actually anemia is a later symptom of iron deficiency, so you can still be iron deficient and have a normal hemoglobin and hematocrit. There are many good dietary sources for iron, red meats especially, but also fish, poultry, fortified cereals, spinach beans, etc. The dietary context has a strong effect on how much of the iron is actually absorbed. For example, iron that is part of heme is highly absorbed. It has high bioavailability. For non-heme iron, the presence of vitamin C and a low pH increases absorption of iron. Iron absorption is decreased by naturally occurring chelators in foods, as well as by calcium. Iron absorption in the intestine is nicely summarized by this image from Robert's pathology. First, iron that's in the form of heme is taken up by a special heme transporter into the enterocytes. Non-heme iron is mostly in the diet as Fe3+, which must first be reduced to Fe2+, before it can be taken in by the divalent metal transporter. Once inside the enterocytes, some bind ferritin, and other amounts of the iron is transported out through ferroportin. That iron in the 2+ state must be oxidized by the copper-containing protein hephaestin to iron 3 in order to bind the plasma transferrin protein shown here. And there's feedback regulation on the amount that leaves the intestinal enterocyte by a liver-produced peptide called hepcidin. Hepcidin, when it's produced in high levels, secreted in high levels by the liver, results in the downregulation or the destruction of the ferroportin protein. Dietary chelators, such as the oxalate shown here, binds to the iron in the Fe3+ state and prevents it from being reduced and absorbed. By contrast, vitamin C prevents the binding of chelators, allowing the iron 3 to exist in the free state and to be reduced and taken up into the cells. Iron chelators are common in many plant-based foods. For example, spinach has lots of oxalate, and many fruits and vegetables have large amounts of polyphenols, as shown here, which also bind and chelate iron. While it's possible for vegetarians to get enough iron in their diets, it is more challenging, particularly for young women and children who need large amounts of iron. So just to recap, there are many dietary sources for iron. However, iron that's as heme, largely from red meat, is the most highly bioavailable. For non-heme iron, vitamin C increases availability. Chelators and calcium both decrease iron absorption. Infants are largely dependent on their fetal stores for iron. Therefore, it's particularly important that pregnant women are screened for iron deficiency. Human breast milk is very low in iron, but that iron is very highly bioavailable to the infant. And one of the main reasons that human infants should never be fed cow's milk is that it causes iron deficiency. Cow's milk tends to cause an increase in sloughing of the intestinal enterocytes, causing lots of iron loss. So given the global frequency of iron deficiency, are there any downsides to just adding lots of iron to foods, doing lots of iron fortification? Yes. Iron overload, or too much iron, is actually dangerous. We know that a hemochromatosis is very common in people from a Northern European descent. It causes excess of iron stores, it causes beta cell destruction, as well as accumulation in the heart and liver and all kinds of serious complications. We also know that for people without hemochromatosis, just having high levels of serum ferritin and high dietary iron seems to increase the risk for diabetes. Iron poisoning occurs far too commonly. Note how these iron pills look an awfully lot like Red Hots. Iron poisoning is corrosive to the GI mucosa and causes unregulated absorption. There are systematic effects all over the body, and it's treated with this iron chelator, desferoxamine. The rest of this lecture will focus on zinc and copper. Overt deficiencies in both of these are quite rare, but they occur and you should recognize them. Zinc is a required cofactor at the active site of many enzymes, such as here in alkaline phosphatase and in superoxide dismutase. It's also required as a structural feature in many proteins, such as zinc finger transcription factors. Zinc is abundant in many foods that are good sources of protein. Overt clinical symptoms of zinc deficiency include growth retardation, hair loss, skin lesions that look a bit like acne, diarrhea, delayed wound healing, etc. Although there are many people who are thought to likely have zinc deficiency that do not yet show these overt clinical symptoms. Just like zinc, we also require copper at the active site of many enzymes, including the peroxidase ceruloplasm, which is a blood protein that is required for oxidizing Fe2+ to Fe3+, which allows it to bind transferrin. Hephaestin, that we saw as part of iron absorption in the intestine, is also a peroxidase that requires copper. Some of the other proteins that require copper are monoamine oxidase, cytochrome C oxidase of the respiratory chain, and superoxide dismutase. Copper deficiency causes anemia and leukopenia, and chronic deficiency can lead to neurologic problems as well as growth defects in children. Copper deficiency is really quite rare, except in cases when zinc supplements are taken in excess, and this seems to happen more commonly in people who've had gastric bypass surgery, or in the rare genetic disease, Menkes disease, in which a copper transporter is mutant. This image illustrates why excessive zinc supplementation is thought to inhibit copper absorption. So the top panel is the normal situation. In the bottom panel, where there's excessive zinc, the zinc in the enterocyte stimulates production of a protein called metallothionein, MT here, which has a higher affinity for copper. And the metallothionein bound to copper in the enterocytes prevents the copper from being absorbed into the bloodstream. These enterocytes that are filled with copper are then shed out of the intestine and end up being lost in the feces. And we're at our summary. The last few slides take you through each of these points step by step. There are 8 minerals that humans require on a regular basis for optimal health. Many are required at enzyme active sites or for other aspects of protein function. Many dietary factors influence the bioavailability of minerals, and iron deficiency is still a common nutritional problem worldwide. Acute iron poisoning in children remains a problem, And chronic excess iron appears also to be detrimental and is associated with insulin resistance and diabetes. Severe zinc deficiency causes a skin problem called acrodermatitis, as well as growth retardation in children. Copper deficiency causes anemia and leukopenia, actually quite quickly, and severe copper deficiency causes neuropathy. Excessive zinc intake, usually from supplements, can inhibit copper absorption. This is true for other mineral pairs as well. Thank you.